Welcome back. Thank you very much for staying with us. Now, a new report by the UNAIDS shows that the world can meet the agreed goal of ending AIDS as a public health threat by 2030, but only if leaders protect the human rights of everyone living with and at risk of HIV. The report, titled Take the Right Path, has been released ahead of World AIDS Day this Sunday. That's the 1st of December. Joining us to unpack the report is Zeenat Abdool, Communications and Advocacy Officer at UNAIDS South Africa. Good evening, Zeenat. Thank you very much for joining us on the program. Now, when going through the report, it sadly highlights long-standing issues, but it also maintains the world can meet the at least goal of ending AIDS by 2030 only if leaders can protect the rights of those living or at risk of contracting HIV. Just take us through the several ways that the rights of those individuals continue to be violated as per the report.
Thank you very much, Namfundo, and a very warm welcome and good evening to your viewers as well. So, as you've rightly mentioned, the report highlights that to end AIDS as a public health threat by 2030 is possible when we protect and uphold everyone's human rights. The UNAIDS report, entitled Take the Right Path, highlights that when legal, political and policy environments uphold human rights, the epidemic can be controlled more effectively by tackling stigma and discrimination. And I think it is important for us to also highlight that the report says that protecting the rights of individuals living with or at risk of HIV is crucial for accessing life-saving services, and violations such as gender-based violence, discrimination and criminalization hinder effective HIV responses. And we're also talking about in this report the impact of criminalization. So laws criminalizing same-sex relations, sex work, they obstruct HIV prevention and treatment efforts, and HIV prevalence amongst gay men and other men who have sex with men is 5 times higher in countries that criminalize same-sex relations. The other important aspect to mention is gender inequality. And so in 2023, 570 young women and girls aged 15 to 24 acquired HIV daily. That's around 4,000 young women a week. And at least 22 countries in Eastern and Southern Africa, this group is 3 times more likely to be living with HIV than their male peers.
That figure, Zeenat, pardon me for interjecting there, that the fact that we're seeing such a large number of young ladies acquiring HIV to this day is quite worrying. What of PEP and PrEP? PrEP being the pre-exposure prophylaxis as well as the post-exposure prophylaxis, and even the U equals U. What is happening there? Why is this not spoken about more?
So indeed, I think we have what is called, we have pervasive stigma and discrimination. We have a huge number of adolescent girls and young women who are vulnerable to their socioeconomic status. I think it is important for us to mention that, when it comes to adolescent girls and young women, they are accounting, as you said, for a disproportionate share of the new HIV infections due to unequal power dynamics, due to gender-based violence, due to limited access to education and sexual health services. There's also poverty and lack of economic opportunities that are forcing young women into relationships with older men, increasing their risk of HIV. I think we also must talk about, one of the findings of the Human Science Research Council's 6th behavioral survey from earlier this year, also talking about the decline of condom use, especially amongst the youth, which is also contributing to the transmission of HIV. The UNAIDS reports highlights that comprehensive sexuality education and economic empowerment are critical to addressing these vulnerabilities. Now, speaking to what you've just talked about in terms of pre-exposure prophylaxis, talking about post-exposure prophylaxis, this is all forms part of education and awareness, and we need to increase comprehensive sexuality education to ensure that young women and that adolescent girls and young women have access to this education, are empowered about their prevention interventions, including you've got the Depeverine ring, you've got Cabellet and lenacapavir, which are the injectables that have been in the spotlight over the past year and a half, which we hope will be accessible
but which are quite
soon.
pricey, we understand.
Indeed, indeed. We must also understand that GBV increases HIV risk by limiting women's ability to negotiate safe sex or leave abusive relationships. And these are some of the contributing factors. In terms of U equals U, we must continue to advocate in terms of comprehensive sexuality education, in terms of messaging that indeed adherence to treatment does lead over time to a suppressed viral load, and that indeed leads to HIV not being transmittable
but
to the next
Zeenat, we're
person.
seeing that, at least insofar as the report is concerned, that 9.3 million people are still struggling to access that very treatment. So they wouldn't benefit, or their partners would not benefit from the U equals U.
Indeed, I mean, the report highlights that harmful laws are obstructing access to HIV services, and that 9 million that you're mentioning is globally. So laws, policies, and practices that punish, that discriminate against or stigmatize people, it is obstructing access to HIV prevention, testing, treatment, and care, and these need to be reversed. Specifically, we talk about key populations, and these are gay men, transgendered people, people who use drugs, sex workers, and others most at risk account for 80% of the new infections outside of sub-Saharan Africa and 55% globally. But too many are still being missed by HIV services because of these laws, these policies, because of stigma and discrimination. It is because of the impact of discrimination that the risk of acquiring HIV is 14 times higher for people who inject drugs, 23 times higher for gay men and other men who have sex with men, 9 times higher for sex workers, and 20 times higher for transgender women than in the wider population globally. So for as long as we continue to have these harmful laws and policies that practices that punish and discriminate and stigmatize, you will see people not accessing healthcare services out of fear.
But now, if we had to quickly zero in on South Africa's efforts, how are they faring now? Because a number of people that we've spoken to, at least that have called in on the show, have sent their videos, they've said at the very least, we've come a long way and South Africa has really tried in their efforts to end HIV and AIDS.
Indeed, South Africa has a very good story to tell. We have just under 6 million people. So firstly, let's say that there's 7.8 million people living with HIV in South Africa. Of that 7.8 million people that are living with HIV in South Africa, just under 6 million, that's 5.9 million people, are on ARVs. In addition to that, we tend to also have the highest number of children living with HIV in South Africa. But there is political will, there is commitment to ending AIDS as a public health threat in South Africa, and there is political commitment. One of these examples is that South Africa is a member of the Global Alliance to End AIDS in Children by 2030. There are policies in place. For example, South Africa has decriminalized same-sex relations. South Africa is, it has a good story to tell. It is a pioneer, if we can say that, in terms of the HIV narrative. But unfortunately, inequalities continue to exist. Unfortunately, we do have a very high rate of gender-based violence in the country. Unfortunately, we do have adolescent girls and young women who are victims and survivors of gender-based violence, and the very same dynamics that we talked about earlier in terms of not being able, that due to power dynamics, not being able to negotiate condom use, due to socioeconomic standing, not being able to access education, and therefore we must ensure that these girls stay in school. Research is showing that girls who do stay in school, who do complete secondary education, are empowered to make better decisions. They do improve their financial standing, and this does help in reducing the risk of HIV infection amongst this vulnerable population.
Zeenat, thank you very much for your time this evening. That's Zeenat Abdool. She's Communication and Advocacy Officer at UNAIDS South Africa.